So a patient says, my eyes look tired. What is going on and how can we fix it? So there's multiple things to think about. First off, are we talking about the upper lid or lower lid? Is it the bags under your eye or is it the upper lid? When we're talking about the upper lid specifically, it could be 3 different things that you have to think about. Number 1, it could be just something called lid ptosis, and that's where the lid margin, where your eyelashes attach, sit lower and closer to your pupil. It can even be covering most of your pupil, and at that point it becomes a reconstructive procedure where we're lifting up the eyelid so that it doesn't cover the pupil anymore. Is it upper eyelid skin, or is it something called lateral hooding, where you need to consider a brow lift? These are the next things we're thinking about. So when you have excess skin or fat, or sometimes too much hollowing in the upper eyelid, we are treating each thing as needed. So if there's too much fat in one area, like the medial part, which is the most common, we're removing that excess fat. If there's too much skin, we're gonna remove a small amount of skin. But be careful with the skin removal because it can make your upper lids look more hollow. And so more often now, the most common trend with the upper lids is to add fat grafting there, because we get more hollow for a lot of the upper lid, and that makes it look more aged and bony and not as healthy. So we're gonna add some fat there often. Then the next thing we wanna think about that's very common is something called lateral hooding. It's when the lateral brow here starts descending and it kind of interconnects with your upper eyelid. So in those patients, I'm usually recommending a temporal brow lift or some kind of endoscopic brow lift to lift up that brow and get rid of that lateral hooding. And there's some patients where it actually is just the brow and not the upper eyelid skin at all. And so we're really just thinking about a brow lift plus or minus the fat grafting. We want to keep volume and attack each problem as needed. And we have to pick it apart and look at all the details to get you to the place you want to go.